Hey, everybody. Thanks for joining us on this Thursday, February 19th. I'm CJ Lemaster, your lead investigative reporter for WLBT and your host for the WLBT Plus Digital News Desk update. Of course, some of you may have already seen our update a couple of hours ago when we were talking about this cyber attack on the UMMC campus involving the hospital's IT systems and severely crippling their efforts to access all of this. Basically changing how the hospital operates. Here's what we know at this point. That cyber attack took place this morning. It caused a major disruption to UMMC's IT systems, affecting patient care, causing them to close clinics across the state, even canceling elective surgeries and procedures because, again, they're prioritizing emergency patients and those who are already admitted at the hospital at this point. The Vice Chancellor for Health Affairs there, Dr. Luann Woodward, said that they're going back to old school pen and paper, tracking in terms of patient conditions, keeping up with that, documentation, things of that nature, because they can't do anything digitally. They have lost access to the electronic medical record system that allows them to track all of that. Hospital, of course, employs more than 10,000 people, serves more than 70,000 patients each year. That press conference a couple of hours ago said that the UMMC officials mentioned they have triggered their emergency operations plans. The FBI is now involved. Department of Homeland Security and U.S. Cybersecurity and Infrastructure Security Agency, or CISA. UMMC saying that the attackers have communicated to them and the hospital is working with federal authorities on next steps. We don't know if this is part of a ransomware attack, if they are demanding a sum of money. We don't know what the specifics here are, but we can tell you that we're working to get more information. We want to show you a portion of that press conference. One of the things that Dr. Woodward had to say. Sorry about that, folks. When talking, I had the wrong thing queued up here. When talking to reporters, here's what Dr. Woodward had to say.
We have communicated to local hospitals, health systems, and ambulance providers. The attackers have communicated to us, and we're working with the authorities and the specialists on next steps.
Now, again, we don't know how long this will continue, and the hospital officials have said the same. As a precaution, all IT systems there have been taken down. And of course, we are continuing. We have team coverage, a number of reporters here working to get more information for you on that. Melissa Price saying hello on this Thursday. Melissa, hope you're doing well. And so this is just too much going on. It is. It's a lot. It's a lot. This is certainly the biggest attack that UMMC has seen. I don't know that they've had a cyber attack per se. There have been data breaches over the years, a handful in the last 15 years, I think. But something like this has, especially to this scale, has never happened to UMMC, the state's only level 1 trauma facility. So it's certainly something that is very serious. Sheikah Hampton saying hello, everyone. And I'm having to do this to kind of see over all the emojis. Sheikah, never shy about the number of emojis, and we appreciate that and hope you're doing well, Sheikah. Lisa Sullivan saying, hey, everyone, on this Thursday as well. We want to also tell you that obviously there are other services that go through UMMC or affiliated. MedCom, the state's standards of care, is not affected. As far as we know from what UMMC was saying, because those systems have dedicated phone lines and other things, those are not being affected at this point. So that means that the state is not being affected in those ways by this cyber attack. AMR Central Mississippi, because you might be wondering about ambulance service too. AMR Central Mississippi says its ambulance services have not been impacted either. Officials with the ambulance provider tell us that UMMC is still accepting patients in the emergency room, and they will continue transporting patients unless advised otherwise. We will continue to follow this developing situation and bring you updates as soon as we learn more. And again, there's a lot we don't know. As we said at 11 o'clock, we don't know if there's been a ransom here in terms of trying to get this information back. We don't know if UMMC had cybersecurity insurance. Some businesses can get that. We don't know whether or not any patient data um, was compromised to the point where, if you were a patient recently at UMMC or know somebody currently who is there, do you have to worry about your personal information being out there, your medical records, your social security number, things like that? We don't know. There's a lot that we don't know. What we do know is that all elective procedures are being canceled at this point. That includes chemotherapy until they can figure out a plan to incorporate that and work that in. But anything that is considered elective is a surgery or procedure that is not considered life-threatening, or it's not a life-threatening situation if that procedure is not performed. John Wilson telling us today that my wife is supposed to have surgery in Jackson Monday. I pray it's still going to happen. I hope so too. Again, we don't know, and I can tell you that just from us covering these stories in the past, when these types of events happen, it sometimes cripples these systems for days, weeks at a time. Whether or not UMMC will be able to access this information through other means and figure out ways to get past this and be able to start offering elective services will determine whether or not, your wife will be able to have surgery, Mr. Wilson. And again, I'm not asking any kind of information either, because HIPAA, we're not trying to ask. That's private medical information. If it is a non-life-threatening procedure, it more than likely will be canceled. If it is not, and it's a life-threatening situation, then from what we've been told by UMMC, they will honor that and they will still have that surgery. We are continuing to try to work and get more information on this, though. One thing I want to point out is that just like we don't know the circumstances involved here, how this happened, we just know that it happened this morning. We also don't know specifically what's involved in terms of the information, and we know that the systems have been all taken offline as a precaution, but there's a lot that we still don't know, and with the federal authorities involved, it might be a while before we learn more information. I can tell you that hospitals in Mississippi are required to have an emergency operations plan, and we know that UMMC is following that according to what they said at the press conference today. We hope that this will be resolved as soon as possible and that folks will be able to continue to receive that care. Britt saying happy Thursday, everyone. Britt, I hope you're doing well too. But that's basically all we have at this point. We're trying to figure out who it will impact here, how it's already impacting those who are at the hospital. If they're using pen and paper, that of course the hospital has they've trained for this. They've always had these backup systems, in a way, the traditional systems in place for in case something like this was to happen. But it's safe to say that it will slow down maybe not affect the quality of the care, but it certainly will slow down the ability to care quickly. Because if you have a number of patients who now you have to see and you have to write these things down, and you have to jot down things that otherwise you could access before, even if you're looking at records from maybe if they had been in the hospital for a couple of days and you're looking for previous things and you can't anymore, you're starting over from square one. All of that demand, that extra work that technology has helped make easier, they no longer have access to until this is addressed and fixed. And so it's safe to say that the frequency by which doctors and nurses can check on you if you're currently admitted, or if you are admitted for emergency procedures or emergency conditions, that might be waiting a little bit longer to see somebody. It might take a lot longer to get what you need, because again, they're operating under what they call downtime procedures, backup conditions, and they're less than ideal, and they prioritize. One thing that it doesn't prioritize is efficiency, because technology has helped so much in trying to coordinate all of this. The downside of that, of course, is when that technology fails, then we have to go back to square one. And so looking to see if there's any other questions here. Yeah, John is talking about he. Okay, well, and I'll tell you what, John, I see what you're saying here, and I won't vocalize that to people. I won't mention it because I'm not trying to just put your business out there, but it does sound like it's pretty serious. The that your wife is going through. Of course, I pray that she's able to get everything she can and that the surgery continues and is successful. Please let us know and reach out to us if for whatever reason they're not able to schedule that, because we definitely would want to get a reporter to talk to you and give you the ability to be able to, if you would like to talk about that, and maybe us helping get you and your wife a voice on this could actually put pressure on to make sure that she's able to have that surgery. And should things change, you can of course reach out to me. My email address is here at the bottom of your screen, Coleman Lamaster at WLBT.com, Coleman.Lamaster, excuse me, at WLBT.com. So please reach out if you have any questions, or if you have cases that you want us to look into. If you're directly affected, please let us know, and we will do our best to make sure that a reporter follows up with you and that we look into it. That's all the time we have for this edition of the WLBT Plus Digital News Desk Update. I'm CJ Lamaster, your lead investigative reporter and your host for this update each and every day at each and every weekday at 1 p.m. And let's see. I'm seeing now a couple other comments here. Yeah, and I'm saying, I know there are folks that are saying, can you please contact me? If Miss Marshall Williams, if you're talking about me, you could reach out to us via email. Just let us know, and we'll definitely try to get back to you. UMMC is also trying to get a number together for folks to be able to handle elective surgeries and things of that nature at some point. When they do that, and when they have that information, we will share that with you. Our early evening newscast start at 4 p.m. today. We are going to have team coverage all evening on this and try to get the most information that we can and the best answers we can. There might be a situation where we can't get it because they're not releasing it. So please know that in these developing situations, sometimes hospital officials don't want to disclose stuff right away. Sometimes law enforcement doesn't want to either until they can get this handled. So we're working with a lack of information, and we're doing as much as we can. Miss Marshall Williams, my email address, I'll put it back up on the screen here, is Coleman.Lamaster at WLBT.com. Coleman.Lamaster at WLBT.com. And like I said, please just reach out to us and let us know what's going on, and we'll try to make sure that a reporter can follow up with you. Our first alert weather team will be in here at 2:30 to help let you know what kind of weather we could expect this weekend. We got rain chances coming. For everyone here at WLBT, I'm CJ Lamaster. Thank you very much for watching, and I really hope that they can get this solved as soon as possible, but we are going to continue to follow up and get you the answers you deserve. Thanks for watching.